All right, good morning, everybody. We're looking at sunshine today, maybe partly cloudy for the afternoon, and daytime highs right around 27 degrees. I think yesterday we were saying like 31, but we'll take 27. It's just about 10 degrees this morning. Actually, I'm showing 2 in Barre, so I'm way off. It was 10 at my house, so 2 above right now. In Barre, Vermont, right on North Main Street. So that's it. Partly to mostly sunny, 27, and then looks like tonight a few clouds and temps down about 20 degrees or so. We got a warm night, and then tomorrow cloudy, some snow flurries, snow showers, all that. Maybe 40 degrees, so it's going to be mild. We'll keep an eye on the roads and the weather for you, and we will definitely keep you up to date on what's happening weather-wise. But yeah, it is a beautiful morning, and we want to thank you for tuning in and getting started. I've got Raylene at my side, who has been very busy this morning, plugging in a few extra microphones as we get ready for these 3 ladies that are right next to me. Here in the podcast studio at Aired Out, and I think what we'll do, ladies, is just go through and have you introduce yourselves. We're live, by the way. Welcome to Aired Out.
Thank you.
Thanks for having us.
We're so happy to have you here, Keri. Let's start with you, SASH coordinator, but there's got to be more to it than that. Tilden House, right?
Yeah, my
Okay.
buildings are Tilden House and Jefferson Apartments.
Okay. And Bonnie? Or Bonnie's not here yet.
Bonnie's not here yet.
Hillary.
Yes, I'm Hillary, and I'm the Director of Tenant Services at Barre Housing, and I supervise the SASH program.
You're the big boss.
Well, today.
For us,
They do all the work, yes.
Yeah.
They're very, yes,
They're the boots on the ground.
absolutely,
Yeah.
100%.
You're the director, and then we have Debbie. Hi, Debbie.
I am the SASH coordinator for Washington Apartments, Corey Hill Apartments, Avery, and Green Acres.
Now, how are you doing this without cloning yourself, honey? I'm just trying to figure that out.
I'm not sure, but somehow it all gets done.
Wow. Are we looking for more SASH coordinators? Are we looking for? Are you hiring?
We're not hiring.
Okay.
We have limited funding sources, so we're not, unfortunately. We
Okay.
could have probably 4 more.
All right. Yeah, I bet. We'll talk about that. But first off, I want to thank you, ladies, so much for coming in here and chatting with us. We have some really important stuff to talk about. Not only what you do, but also what's going on in our community, what's going on in our society, what's going on in the state of Vermont. Tell me about it, and I guess Debbie, we'll start with. Well, no, let's start with Hillary. Yeah.
Okay. Yeah. All right.
Listen, here's the thing. I definitely won't throw any questions at anyone that they can't answer. But I mean, just give us a broad scope of what SASH is. This is something that, correct me if I'm wrong, it started in Chittenden County.
Yes, it started in Chittenden County at Cathedral Square, and SASH stands for Support and Services at Home. And our goal is to help people live in their homes as independently and as well as they can for as long as they choose to do so.
With the goal and the objective to let them age in place, which
Yes.
it seems like Vermont is a pretty pro age in place state.
Absolutely, yes. Yep, and I think with the SASH coordinators' help, they help to connect them with services that enable them to do that, whether it be Meals on Wheels, Council on Aging, help them with their to Medicare, prescription programs.
Yeah.
We deal with a lot of food insecurity, and the SASH coordinators themselves deliver, hundreds and hundreds of pounds of food
Yes.
a year, and
Absolutely.
it's so those are some of the things that they do. But yes, Vermont is definitely an aging in place. And that's our goal, is to help people live as well and independently as they can.
Chris Desereau just wrote in and said the 3 mayors of Barre right there. What's that now? I think we're good. Yeah, if you ladies could just move a little tiny bit closer to your microphone so we can hear you a little bit better, that'd be great. But
Tell Chris I don't think the mayor gets paid, do they?
Here's the other thing I want to say. There's no rules here on this podcast. So I encourage you to jump in, chime in anytime, cut each other off, interrupt, get the message out there. I mean, so yesterday, State House lawn was a big press conference. Bernie Sanders was there. Our governor, Phil Scott, was speaking and basically saying that we're in a crisis right now. Surprise, surprise. I think so many of us could see the writing on the wall with the nursing shortage in our skilled nursing facilities pre-COVID. But now things have come to a head, and we're in a crisis situation. I mean, it's like, not to be super blunt here, but it's like beyond disgusting on so many different levels. The level of care, and maybe unintentional neglect that's happening with some of our elderly. Our nursing homes are at, in many regard, capacity, and we need more and more and more folks to essentially not have to go to a nursing home or a skilled nursing facility.
Correct. That's our main goal, is to keep people out of nursing homes, not go to like the ER and then come home and then go back, and
Sure.
and minimizing those things for people, so that they, and if they do go to a nursing home, these guys are there to meet them.
Yeah.
And help them transition back into their apartments. Like sometimes people, you guys can say that, they come with new meds and
Sure.
they don't know.
Right.
They just went through something major health issue, and they don't understand what the difference is of their meds. Right. And
Yeah.
A lot of times you'll see that we have participants that are discharged from hospitals, rehabs, with 2 days worth of meds, no Medicaid, no financial resources to afford these medications. So that's where we step in and find resources for them to get their medications that are affordable.
Yeah.
on Friday at 4:30.
Waving a magic wand.
Yeah.
Really?
We have magic wands. We really do. I swear, these guys do. I swear to God, they do.
Especially Debbie.
I
Yeah,
always
Debbie's-
say, if I was ever in an accident or really sick or anything like that, when I wake up, my family and these two and Bonnie better be there.
Yeah.
Because I want their help.
So basically, you guys can get involved right from the get-go.
Correct.
Yes.
And with the understanding that we may have to come out of an emergency room or a hospital and go to a skilled nursing facility. But if you guys can get involved even after someone has arrived at a nursing home, you might be able to help transition them.
Absolutely.
And weigh some different options.
Yeah.
Sometimes we don't even wait until they're at the rehab facility, whatever skilled nursing facility. We work with the emergency department care managers, as well as care managers and CHTs in our primary care practices.
Yeah.
So if there's somebody that we're super concerned about and they've taken a trip to the ED, we're on the phone sometimes by time they've arrived at the ED saying, "You have one of mine coming in. This is their backstory. Work with me."
So I'm guessing here, ignorance, but I'm guessing that the staff at hospitals, they're really connected well to you, and
Yes.
they're a phone call away.
Absolutely.
Yeah.
They like the SASH coordinators.
Yeah, I bet. So are they also able to get a read on someone that's coming into the hospital that maybe has or doesn't have Medicare or Medicaid, that they may have been to the ER twice in a month or two, and they've been sent home, And
Correct.
we need to get SASH involved as kind of preventative maintenance here.
Correct.
Absolutely.
Yeah.
So there was a situation that you just described. I had a gentleman who had a major stroke, went to the ED, and then from there went to rehab. The whole time he was at the hospital and rehab, he had no Medicaid, no Medicare. So when he was discharged with 2 days of meds that he could not afford. Didn't even have the resources to pay for them or access to pick them up.
Yeah.
One of those meds, if I recall, was actually like a $500 script.
It's like $1,200. Yeah,
Yeah.
like $1,200.
Either way, we Debbie and I both kind of teamed up on that and worked with the CHTs to get them to change it to a more affordable script that would do the same thing. We got discount cards from the primary care practices to help cover the cost of those meds in the 11th hour.
I think we should say the CHT is the community health team. So doctors'
Right.
offices have incredible nurses and that work there that work really closely with the SASH coordinators to help make all these things work out.
Some are nurses, some are social workers.
So
So when we're talking about one individual, just that one individual, you guys are individually for you. You're probably talking to upwards of how many people for that one individual? I mean, there's family, there's the patient themselves, but there's doctors, and oh my
Right.
gosh, I mean, I can't
It's a
imagine.
whole team.
Right.
yeah,
It's a lot of collaboration.
and like Raylene just said that a lot of people don't have family. I mean,
Right.
Right.
these two have been the person for many people. Like, I mean, I just can't even stress that enough. Some people don't have anybody.
Yeah.
And some people actually have language barriers or a disability that doesn't allow them to communicate or articulate with us well.
Right.
And you all have your hair. You haven't pulled it out yet. I mean, this is. I can't imagine the stress, the multitasking that you've got to do. You've got to be on your toes. You have to be managing so much all at once, all at the same time.
There's a lot of fires that are being put out on a daily basis.
Yeah.
And then you have to try to prevent those fires too by
Correct.
by just being so dialed into these different buildings and the residents that live there.
Exactly.
Wow.
While maintaining the guidelines for our panel, which means that we have to keep a full panel is 91 participants
Right.
or above.
And so I think I maybe left out the point that so the SASH coordinators are embedded in the housing authorities buildings. We do some community-based folks, but it would be great if there were more SASH coordinators to do more community-based stuff, because I'm sure that there's people out there in private homes that could use these services as well. And maybe it may expand to that, because I think that SASH has really proven itself to be, I think it has good data showing that we have helped to reduce hospitalizations, reduce reoccurring hospitalizations and nursing home stays, and trips and falls. So there's another thing that we focus on, as well as chronic conditions and helping people to manage their diabetes or other chronic conditions they
And
have.
all of this ends up with less claims, really, for Medicaid and Medicare.
Right, and less on the people that are having to continue to go back and forth.
Right.
And so, yeah, absolutely.
Wow. So what about the folks that don't live in the North Barre Manor or Avery Apartments or Washington Apartments, Corey Hill Apartments? What about the folks that are elderly who just live in our community? Do you serve them as well?
We serve some
do.
of them.
Yeah, some of them.
Yeah.
Yeah.
The thing, in order for us to be able to serve anybody in the community, is that they have to be on Medicare.
Okay.
Yeah.
Okay.
It can be a younger disabled on Medicare, but they have to have Medicare.
Yeah. And you can help facilitate that.
We can.
Yeah.
Yes.
Or at least point them in the right direction.
I mean, for us,
Yes.
we've looked within Barre housing for some of our community participants by accessing those that are receiving Section 8.
Yeah.
So,
Right.
you know, elderly, disabled on a Section 8 voucher, we've gotten referrals from within our Barre housing organization.
Or we would receive referrals from our local CHT partnership, Council on Aging,
Yeah.
Washington County Mental
Mental
Health.
health, yeah. Yeah.
Sometimes the ED reaches out to us,
Yeah.
says, hey, this person just presented. Are they a SASH participant? If not, can we sign them up for
Right.
SASH? I could use your help.
What do y'all have, like 3 cell phones for each of you?
No.
No,
No, it's the secret bat signal.
Oh, you got the bat phone? I mean, I can't imagine how busy you are and how challenging this must be, even pre-COVID. I mean, wow. How has COVID made this more difficult for you, more challenging?
The guidelines are stressful. The working from home was definitely a challenge. I'm like a hands-on person, so I'd rather see people and be around people than having to make phone calls and trying to assess over the phone if they were truly okay.
I think you're going to find now that COVID is here, the barriers of our participants have increased tremendously. There's more people that are isolating, more people that are food insecure, more people that are fighting or struggling just to make ends meet, and then add the increase of food, increase of everything into it, and they're not getting any additional money.
Yeah.
Yeah.
Speaking of money, where's the money coming from? How is SASH funded? How do you guys exist?
So we have a couple.
Yeah, we get money through Cathedral Square, which is sent to, we're the DRO. So we get, well, we're one of them, and we get money sent to us, and we have I guess a contract with them. I mean, we
Yes.
do, and so they give us money to help for the SASH coordinators and the panels, and then the Barre Housing Authority takes on the other stuff like insurance and office supplies, and we set them up
Right.
in their buildings, and so the funding is through the Blueprint for Health, and I think
One pair.
in One Care, and we're no longer a pilot. We've been in existence for 10 years.
Correct.
Yeah, so
10 years.
I've been at Barre Housing Authority for 10 years, starting in June. In June this year will be 10 years, and the SASH program has been here in Barre, but at Cathedral Square prior to that, where it was a pilot for many years.
So there's got to be, it's got to be very clear and obvious that you guys are so needed. I'm guessing that the funding that comes down through the pipe every year, every other year, something like that?
About that, yeah.
I'm guessing that you haven't had to spend any time trying to prove yourselves, because the proof is in the pudding for what you do, right?
I hope so.
Yeah.
Yeah, I think it's, yeah. I mean, I think that in the beginning there was, we wanted to make sure we weren't duplicating services. So
Yeah.
what we really wanted to make sure that we were, we are working as a collaboration with Council on Aging, Central Vermont Home Health and Hospice, Washington County Mental Health. We have a really solid working relationship with all of those entities, and I think it's crucial that we do.
Right.
I think if one thing that COVID's done is it's made it a little bit challenging with some of our partners. Their staff is limited, their resources are limited. So for us getting the supports and services that we've identified that our participants are needing, is really a struggle when they have to be waitlisted for long periods of time.
Sure.
Yeah, because some agencies just are really, we're not going into people's homes, and that's totally understandable. I mean,
Yeah.
it's
Right.
As SASH, we've kind of filled in the gaps.
Wow. I just I don't know how you do it. How do you unplug at night? And I mean, are you ever punched out? I mean, how do you emotionally not?
I think there's a lot of sleepless nights.
Yeah.
Because you go over, I shoulda, coulda, woulda, or I need to remember who is high priority and who needs what.
What's a
Absolutely.
Hillary? What's a typical day for you?
Well, in the SASH program, I thankfully usually these guys have the typical day. They'll come in and run stuff by me, but they're really the ones that could tell you what a typical day is.
And I don't think there is a typical day
Yeah.
because
Really?
every day
That's
is
challenging
different.
to say.
Every day is different.
Yeah.
Yeah. There's not 2 days that are anything alike.
You have a bunch of things scheduled, but your day doesn't really go like that.
No.
My goodness.
Yeah.
Raylene, who's just off camera here, she and I don't want to speak for Raylene because she'll run over here and grab the mic from me. But what a lady! She has embraced you guys and
She has.
made sure
Totally.
that the residents in these homes have had an outstanding home cooked meal for the last 2 Christmas Eves.
Absolutely.
Yes.
And we are so grateful
So
for
grateful.
Raylene for
Absolutely.
ensuring that our community has a healthy, nutritious meal at Christmas Eve.
Yeah.
I can't say that what our participants would be eating Christmas Eve if it wasn't for Raylene.
Yeah.
Absolutely. There's a lot of programs that seem to be available for the Thanksgiving holiday. But when it comes time for Christmas, Raylene's program is the only program that has
Yes.
been available
Yeah.
for us to access to ensure that our participants and anybody else in the community can get
Yeah.
a home cooked meal for the holidays.
Raylene and Sherilyn and Elizabeth was there this year, and some other folks that have a long list of folks actually that have reached out to Making Spirits Bright and said, "Hey, we want to get involved. We know it's Christmas Eve, but we want to be there. We want to do something. How can we help?" So, who knows what this is going to turn into?
We thank Raylene and her partnership tremendously.
Absolutely.
And we're talking about we're not talking about like 50 or 60 meals.
No.
What was it, Raylene? 400 meals?
This year was 300. Last year was 535.
Yeah. 300 meals is a lot of work.
And out of those 300 meals, I would venture a guess that at least 100 of them went to SASH
Barre housing.
participants
Yep.
within Barre housing.
Amazing.
Yeah.
Amazing. And then all the, there's so many volunteers for this. The drivers, the delivery drivers who are
Right.
getting these meals out of the kitchen, which was at the American Legion this year, and getting it to the doors and available for these folks is amazing. Amazing. What's next for SASH? What do we have? I mean,
We have a wish
Well,
list.
Yeah.
we do have a wish list.
So I think what's next for SASH is to be able to afford our participants, our residents, to be able to afford monthly foot clinics. That is so important for a lot of our residents.
understatement.
Yeah.
Oh, yeah.
And at $25 per person, they just can't do it.
Yeah.
There used to be funding for that, and that has been cut. So now our residents, our participants are having to afford that on their own. And a lot of them are not having their foot care done.
Exactly, especially when you're trying to manage diabetes.
Yeah.
Maintaining healthy feet is
it's
huge.
Difference between life and death or
Correct.
amputation.
It could be, but that $25 could also be the difference between purchasing medications
Yeah.
and having their feet checked.
Right.
So
Or food.
exactly.
Correct.
Yeah, and I think in Debbie's building, we used to have a program called the Haas program, and that was a really old program that went towards the money went towards foot clinics and homemaker services, and then it got absorbed into the blueprint And so then we decided that because we did do a contract with Home Health, and we said because that has always been offered in the Washington apartments, foot clinics have been, and they were free at
Yeah.
that point, that we collaborated with Home Health, and we offered, Barre Housing offered to pay for half, so the tenant can pay $1,250 instead of
Wow.
the whole
That's
amount.
still
And
a
that's
really
still a
struggle.
lot, but,
Yeah.
and we can do that this year, and we're just hope we can do it next year. And to do it in all of our buildings would be awesome, but
What do we need to do to make that happen in all the buildings?
I wave our magic wand.
yeah. Sponsor a
I-
senior for foot clinics? I don't know.
I mean,
Something.
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 We
yeah.
need funds.
Well,
Yeah.
maybe we can try to help figure that out.
That would be great.
That would be amazing.
And I'm not sure exactly how.
Yeah. Well, I think talking about it and making it, and
Yeah.
just saying that it's a need, it's something that,
Yeah.
and it's a pretty basic need, getting your
Yeah, sure.
your feet done.
Yeah.
You know.
Right.
Maybe we can kind of create something or do something so that there's a one hub, one fund where donations are going, which is specifically for foot care to try
That
to
would
get
be awesome.
to
That
try
would
to
be
get this
amazing.
in all of these buildings. I mean,
Yeah. It
We
would
gotta
help
do it,
so
man.
many seniors, disabled people, you know,
Yeah.
like you said, between life and death.
yeah,
Yeah.
sure is.
Absolutely.
Absolutely.
Well, I mean, we're gonna put our heads together and see if there's something, and maybe there isn't, but maybe there is, and if there
Right.
is, we'll find it. And microphones are very powerful tools, and
Yes.
it can bring our community together. And
Together.
we've done that a lot here at the podcast. So we're obviously we all know each other now. So we have a relationship. We'll be in touch. What do you do when you're in one of these buildings and you see that someone might not be taking after themselves very well with regard to cleanliness in the home, or maybe personal hygiene, or maybe the food that they're eating, or maybe all of those three are in great shape, but you've noticed that they're seriously down in the dumps.
So, if they're not a SASH participant, we will try to encourage them to sign up for SASH, because that's what will allow us to help them.
Right.
If somebody is feeling really depressed, we have resources through Washington County Mental Health's Elder Care Program. We can make referrals and get them a therapist that can come to them in their home and work
Wow.
with them and try to get them to a place of feeling better.
Yeah, and
We-
I think that's the uniqueness of being embedded in our buildings, is that if you are or you aren't a SASH participant, we see these people on a daily basis, and they also have friends that, they're little communities within themselves, and they come and they tell us,
Yeah.
and they, or we notice that so-and-so hasn't been out, and so that gives us the opportunity to, make that connection with them and to reach out to them. So I think that's the special part about being embedded in the buildings,
Yeah.
is we really get to know our tenants, and
Wow.
yeah.
Word of
Yeah.
mouth travels fast.
Yeah.
And I don't know, I can't speak for Debbie, but my approach, especially when we have new people in the building, is I really try not to pressure anybody to sign up for SASH. It's voluntary. Like,
Correct.
you're driving the truck. So, I just start by making a very casual relationship with somebody. And sometimes after 5 or 6 months, they might finally be ready to sign up for SASH and say, gee, I wish I'd have done this sooner.
Yeah. I'm sure you've heard that quite a bit.
But I think that's a really good point that Keri brings up, is that we call our SASH people participants. So if you're a participant in SASH, you really are in charge of where you're going. Like we develop a wellness plan, it's a healthy living plan.
Healthy living plan.
And so it might be that they want to, listen to classical music, or
Yeah.
they want to maybe walk the floors. They
Yeah.
walk down one floor and then up the stairs, and we help them to make that, for that, whatever their goals are, we help them to
Yeah.
get there.
They will identify their own goals.
Yeah.
Yeah. I think of the Tilden House in the proximity to the Barre Opera House. I mean, it's literally a stone's throw. I'd love to. Wouldn't it be amazing to have a business, or maybe one of the existing sponsors that has been actively involved with the Opera House, have some resources, financial resources available to you guys to be able to say, hey, Friday night there's a concert or an event that's going on at the Opera House. The tickets are normally whatever, $30. We've paid for half of the ticket or the whole ticket. We have 10 spots available.
That would be awesome.
Wouldn't
That would be great.
You've got to get out from those four walls, and I understand.
Exactly.
I understand COVID, and I get it, but I'm thinking further beyond that. These folks have got to get out, get some entertainment.
Gets them out in the community. It helps with social isolation and loneliness,
Yep.
Yeah,
which are some of the things that we are looking to identify on our yearly assessments.
I'm sure you are. More now than ever.
Yes.
Yes.
Yeah, because we have kind of in our buildings put the kibosh on large groups gathering for bingo or
Yeah.
community meals, and so unfortunately, it's that's the route we have to take just to try to keep people safe.
Yeah, I bet.
Yeah.
I bet. Are you coming over to join me? Here, go ahead. Go ahead. I told you we were casual.
I like that. That's awesome.
I told you.
Move over, Bacon.
We've only got 4 microphones going right here. I lost one. Take it away, babe.
I want to know what you could use for volunteer services in the program that from community members, even if it's a ride somewhere. As we were talking before the show, maybe even for a COVID test or a doctor's appointment or just a companion, read with, knit with. Are those services that you could use and you would use?
Absolutely would, and I think that thinking after COVID, we'd love to do like paint and sips and have people come in and do do arts and crafts. I don't know if it's just me, but I just feel like volunteerism has dropped even pre-COVID. Like if you're part of a group, you kind of the same people come in and volunteer, and so I think that tenants would love that, and I think if we could collaborate with younger folks too that came in and had a relationship with the older folks in the building, I think volunteers would be greatly appreciated.
Yeah,
I
it
know,
would make a huge
pre-COVID,
difference.
One of the things that I was trying to do was get the local high school to come caroling in the hallways.
Yes.
Like U32 does over in Montpelier. I really wanted to have that for our folks here in downtown housing. I just feel like something as simple as that could bring them so much joy, but even...
We did do that once before you, and that was so well received. So yes, things
I
like
can
that.
imagine. Yeah.
That was pre-COVID. I think it was pre-Keri. Pre-Keri, pre-COVID.
Right, I'm the newest coordinator. I've been here a little over 3 years, so...
But, yeah.
So, and then can we just kind of, I don't know, put a definition on the program itself, because we kind of haven't done that, and then let folks know that there are several different SASH programs, and you are SASH through Barre housing.
Yes.
Something
Yes.
totally separate from the Vermont State Housing.
Correct.
Yes.
You're
And
all,
down
you
street.
guys are
And down
all
street.
down street. You guys are
Down street
all on
separate,
your own.
Cathedral Square.
Yep.
This is who
Montclair
you are
Housing.
and what you
can
do.
you
Yep.
can look
As
it
a
up at
group.
sashvermont.org. There are SASH sites all over the state.
Yes. And
Okay.
so SASH stands for Support and Services at Home.
Okay.
That's what it is. And yes, they're all over Vermont.
Okay.
And technically, they are embedded in housing
And public
authorities.
housing.
Some of them are in senior centers.
Yes. True.
The requirements again?
The requirements for a community participant would be they have to have Medicare.
Yep. Or we're in the process of helping them get Medicare
Correct.
in our
There are
buildings.
guidelines for public housing. I don't believe there is.
Right. You have to.
They,
if you live in our
they just have to
buildings, we're
live
gonna- yes.
in the hub site.
Yes. So
Right.
we're not going to exclude people from a program that we offer to people.
Age doesn't make a difference.
No.
I mean, technically, I think this program was originally designed to help seniors age in place, but the younger disabled population is growing in public housing. And so
Correct.
so I have participants from 18 to their 90s
Yeah.
in my buildings.
We're getting a comment here. Would you consider a church coming to Carol in the buildings?
Yes.
I would love that.
Absolutely.
That would be really helpful.
Oh, we got a lot of comments here.
Great.
Oh, good.
We encourage you to check out. But in the meantime, and I'm serious here, wouldn't Raylene make an amazing podcaster? I mean,
Yes.
She's awesome.
isn't she just? I mean, don't you think? I mean,
Yeah.
that she should have her own podcast.
I think she should.
Yeah, she's got a Nerf gun over there that every now and then she'll shoot at me. So, but anyway, I'm glad that.
At least it's a Nerf gun.
I could put her to work.
Oh, look, she's got a bag of Nerf
Lock,
little,
stock, and both barrels.
bullets there.
I'm so glad you all came in here. Tell Bonnie that she's next.
Yes.
Okay,
Yes.
Absolutely. And thank you for having us.
Yes,
Thank you so much.
Can we get you back in here again soon?
Absolutely.
Absolutely.
Come anytime.
You'll work that with mostly Raylene, but work it with us. We'll get you back in here. You know, if there's anything that's any kind of message you want to get out to the community, especially one that's kind of time sensitive, or if you're hoping to do this or do that or kick this off or whatever, or just a reminder to people, we can't hear from you enough. So please know that the door's open. Get back in here soon, okay?
Yep.
Thank you.
We really appreciate it.
We loved having you in here. Thank
you.
you so much. The ladies from SASH, Debbie Boyce, Keri, and Hillary, thank you ever so much for and thanks for being part of it wasn't that bad, was it? No. Yeah, of course not. It is presented, aired out by Barstow Construction and Granite City MMA, Preston's Kia, Gauthier's Quality Grounds and Maintenance, Wright Electric, Wood Doodles, Donnybrook Fight Promotion, the Barre Montpelier Times Argus, ASB Financial, which is where our studios are here at 185 North Main Street in Barre, right across from Nelson's Ace Hardware, Vermont Custom Woodworking, CW Creative, Gusto's, FGB Theaters, Barre Area Development, the Central Vermont Chamber of Commerce, Salvador and Babbitt, Fecto Homes, Green Mountain Mulch, Fontaine Forestry and Millworks, and Giroux General Transport, our newest sponsor. Be well, everyone. We'll catch you again real soon, and thanks for catching Aired Out.